Welcome back to What's Now. We are going to shift our attention to chronic kidney disease. I recently spoke with David Rush, recording artist, motivational speaker. He tells us all about his experience with CKD that started back in high school, and he's joined with a doctor, and we find out exactly what you need to know about this condition. Producer, recording artist, and motivational speaker David Rush is a busy individual, having worked on projects with Pitbull and even touring with him as his opening act. But he's also working to educate people about a potentially serious medical condition that caused him to go into kidney failure when he was just in high school. Rush joins us now to talk about his career, what it's like living with chronic kidney disease, and the gaps in care in the Black and minority communities. Joining him is nephrologist Dr. Jessica Coleman. Dr. Coleman and David, thanks for being here today.
Thanks for having us today.
Thank you.
David, can you tell us about the latest news surrounding your music career?
Music career has been going great. You know, as you know, with everything going on, I kind of stepped back from the spotlight, as you could say, but still working on music all the time, being locked in, constantly working with different artists, collabing with as many people as possible, and you know, trying to wove my journey into my music as well to kind of be a voice for people that are in my situation. And it really has been a positive thing for me to continue to do that. Just trying to stay as active as possible and creative as possible as well. So it's really been a helpful tool to be able to put my story into music.
And you've had really quite an experience with chronic kidney disease starting at a young age. Tell us more about that.
It started in high school, actually, 10th grade. I was just going for a routine physical for football, and I ended up having protein in my urine. Was then sent to a specialist in New York who said that I had acute kidney failure. I had no knowledge of what that was about, and just, you know, was kind of confused with it. Being that young, you think you're invisible, and those things can't happen to you, but they can. Later on, I then was diagnosed with full renal failure. I started dialysis, then was transplanted in 2010. Had a transplant for 7 beautiful years that I got from my brother. And now I'm currently back on dialysis, doing it at home. The whole journey for me has been up and down, but you know, I try to keep a smile through it all, stay as positive as possible. And now I'm on a new world tour, trying to educate as many people as I can to live well with CKD and hopefully prevent it for some that don't have to go through what I've been through through the years.
And specifically, what are you currently involved in regarding educating people about chronic kidney disease?
Well, as a motivational speaker, you know, you go around, you try to have these conversations and put as much forward as you can. And luckily, I've been able to team up with AstraZeneca, and we started UnfilteredKidneyConversations.com. It's a website you can go to and have these conversations, ask questions, talk to other patients like yourself. Even if you're not a patient, if you have questions about, you know, kidney disease, or you have a family member or something that is going through it, you can come here, meet with us, and have these talks. Build the gap between doctor and patient relationships, and really just kind of give you a chance to see what it's all about, and just becoming a voice for this world. Once again, UnfilteredKidneyConversations.com, and I encourage everyone to check out that website and just get involved and get the knowledge.
Dr. Coleman, what can you tell us about the impact of CKD, especially among Black Americans?
Absolutely. Well, we know that unfortunately there's a disproportionate increased rate of incidence of CKD, and of course the progression, unfortunately, to ESRD or end-stage kidney disease requiring dialysis in Black Americans and other minority populations. In fact, 3.5 times more likely than white Americans. And so, especially in the month of April, it's so important to highlight that disparity so that we can better understand it and raise public awareness, again, so that bridge between the doctor-patient relationship can be stronger, just like David mentioned. Going through the process of educating patients about CKD, the more a patient understands about their own health care, the better they're going to do, no matter what the situation or disease process is.
Dr. Coleman, what are the most important issues surrounding CKD you'd like people to know about?
I think the fact that CKD isn't just about the kidneys. I think that's probably the most important take-home point. Most people have heard of other disease processes like anemia, having a low blood count, and they're pretty familiar with the fact that that can make you feel pretty tired or run down. Some people may have heard of hyperkalemia or having a high potassium level. These are other disease processes that may not seem to be intersected with kidney disease, but oftentimes really are intersected with kidney disease. So understanding that routine lab work can really unveil some of these potential problems, and then again, having a better understanding of how to live well with CKD and how to partner with your doctor, I think that's the take-home point. This can be such an intimidating subject, and by using something like a discussionary guide where we can start that conversation so that that conversation is not quite so intimidating out the gate, I think it allows patients to better understand their own health care. There's a great discussion guide that can be downloaded and can be a great resource for patients on unfilteredkidneyconversations.com, and I think that provides a great starting block for this conversation to be initiated.
Well, thank you so much, Dr. Jessica Coleman, for lending your expertise to us in this area. And David, thank you for inspiring others by sharing your journey around CKD. We appreciate you taking the time, both of you, with Park City Television today.
Thank you so much. Thanks for having us.
Thank you for having us.